Away from matters to do with the strikes, and President William Ruto has challenged African countries to invest in local manufacturing of health products to sustain the hard-won gains achieved in family planning, maternal care and birth spacing across the continent. Speaking during the high-level heads of state-side event on accelerating maternal mortality reduction in Africa, on the sidelines of the 39th African Union Summit in Addis Ababa, Ethiopia, the head of state said Kenya is implementing a 40% local procurement requirement to reduce exposure to external shocks. President Ruto, who also chaired the inaugural committee meeting of heads of state and government on the implementation of the African Continental Free Trade Area, urged leaders to implement the agreement on bringing African markets together to increase intra-African trade by up to $3 trillion and raise Africa's cumulative GDP by about $1.4 trillion between 2021 and 2025.
Continental financial institutions, including the Africa Development Bank and Afrexim Bank, should continue converting commitments into practical, bankable projects for manufacturers. The Africa Continental Free Trade Area must be powered by African production. Without strong local manufacturing, it risks becoming a channel for imports rather than a driver of African industry. To translate these priorities into coordinated action, I therefore propose that the Africa Union convene an extraordinary meeting on local manufacturing this year.